Good evening and welcome back to Studio 51 here at EMS Update 2025. My name is Chris Dell. I'm happy to be your host once again for another exciting conversation. My next guest is Jason Brown. Jason is the Director of Healthcare and Emergency Preparedness for the Healthcare Coalition of Western Pennsylvania. That is a mouthful, to say the least.
It is, sir, especially when you consider there's 6 of them across the state.
Fantastic. Would you please tell us a little bit more about the Healthcare Coalition?
Sure. So the healthcare coalitions operate on a grant from the Health and Human Services at the federal level. So Pennsylvania receives a lump sum of money every year. The Department of Health disperses that money through the 6 healthcare coalitions across the state. The Healthcare Coalition of Southwestern PA being one of those coalitions who receives funding specifically to put towards emergency preparedness work in that region.
Oh, awesome, fantastic. So where exactly does EMS sort of fit into all that?
So EMS is a critical component to all of our healthcare coalitions across the state. In fact, HHS sees them as a critical pillar with hospitals, EMA, and public health in that particular healthcare coalition. So EMS plays a critical role. In each one of those coalitions, there's a specific EMS subcommittee that they're consistently working on what ways to improve their level of preparedness across that region, and then working with the rest of the coalition to bring those things to fruition.
Awesome, fantastic. Can you tell us more about your background?
Sure. I started my career in healthcare. I have a fire and EMS background, though provider haven't been for a very long time.
Yeah.
But
where was that?
In the outside of the Harrisburg area,
Okay.
Mostly in the fire department
Okay.
realm of it. I started my career in healthcare as an emergency management coordinator at Holy Spirit Health System.
Oh, okay, I'm familiar with Spirit.
And continue to work my way up. As this grant particularly started in Pennsylvania in 2012, I left there and have been working on the grant ever since.
Okay. Well, I think it's important from my perspective as an EMS provider to know that the person managing this particular grant program and so forth has an EMS background, because understanding the needs of EMS and fire is important.
Very little.
Sure,
but,
understood.
But a little.
Fantastic. How does EMS exactly fit in? What can EMS agencies be doing to participate? Because I think that I'll speak for myself. I'm actively involved in a lot of different things, but honestly, the Healthcare Coalition of West Pennsylvania is something that's become only kind of new to me in the last several years.
So, I like to look at it as it's that next level. It's the larger scale incident where I now need to be concerned about family reunification, patient tracking, making sure that everybody that was at that scene made it to the appropriate medical center, and then we have accountability for them at those centers. So, ensuring that they're all working together to ensure that we're providing the right care, the right person, right time, all of that. But at the same time, ensuring that we have the resources necessary to bring to bear to that particular event, and where the coalition fits into that is providing the situation awareness platform. Across the state of Pennsylvania, we use the Javari eSuite of applications. EM-Track is a specific portion of that that's really geared towards the EMS providers, and providing a mechanism that we can track those patients leaving the scene, give that alert to the receiving facility, and maintain the tracking of that patient through the initial touch through ultimately the discharge if need be.
And that's been a very great project. The patient tracking is something that's been attempted a number of different times in different venues and different applications. But the EM-Track, I should tell you, from my experience, usually in drills and so forth at this point, has gone very well. So we're actually planning, our agency and a few other agencies in the North Hills of Pittsburgh are planning to have an EM-Track day, where we're just going to be tracking all of our patients. And I know there's a lot of effort spent, and obviously we need to get more agencies involved in using it. But I think the key to that type of software is the more you use it, the better you get with it. Comfort.
It certainly is. We've been trying to push that through special events, whether it's a large-scale mass gathering that's occurring in your community, whether that is a pre-planned event or unfortunate emergencies in the aftermath of an event, of utilizing it, whether it's a long-term care facility evacuation or whether it's truly that MCI, of ensuring that we've provided the right people and that we have the documentation to show that they received the treatment that they needed and they made it to the destination that they needed. While there's, I struggle that there's not a day-to-day benefit from the EMS provider in using that app. So when you talk about usage, it isn't something, I hope you never have to use it. I hope you never experience an incident where you have to use it. But the day that you do have that incident and you're that responsible party with the responsibility to that municipality, being able to say, yes, although we had this very horrific day, we know where everybody's at, making sure that the family members of those involved know where they're at.
Absolutely.
And being able to share that information effectively.
Yep, absolutely. Are there other future projects that you can tell us about, or any other ongoing projects that are maybe EMS related or not EMS related, but with a tie-in?
So I think the healthcare coalitions, we use a term called patient tracking specialty services, where we're trying to engage with those EMS agencies that get it, that are using the application, that understand how it works, and how it's benefited them. So we've created a contractual relationship between the healthcare coalition and that EMS agency. Not that anybody's getting rich off of it, but it's taking the time of that EMS supervisor that works for that particular agency being able to go out, share that with the community next door, maybe even a competing EMS organization, but sharing their level of knowledge, their interaction, how they utilize the software and where they see the benefits.
Sure.
If you're that EMS provider or that EMS organization that wants to take that step, you can certainly go to pahpp.org, which is the coalition's website platform. If you register there, you can join your coalition, get engaged. There's monthly meetings of the coalition as a whole and the specific committees that are involved there. But being engaged and then, potentially being one of those patient tracking specialty services and being able to go out and teach others how to use the application.
That's great, because I'm sure there's a need. I mean, the bottom line is there's 1,000 ambulance services in Pennsylvania. In Western Pennsylvania, there's plenty, so just a focus
and there's
there.
one regional readiness coordinator associated to all of those. Now there's
and who's that regional resident?
in southwestern Pennsylvania, Rick Lippert is that individual. If you're looking for a contact or a direct point of contact, Rick would be that guy.
Great. Okay. Well, I think a lot of people know Rick. A lot of people are familiar with Rick. That is a helpful thing. I know I don't expect you necessarily to be able to rattle off emails and so forth at the moment, but is there a particular website you can refer folks to?
Yeah, PAHPP, Pennsylvania Healthcare Preparedness Program.org. Those initials will take you to it's a social media network. It's an entire platform, not just a website. So it's going to ask you to register and go through that process. But it's just other providers across Pennsylvania of healthcare emergency management, EMS, emergency management coordinators from across the counties. But
so hospitals are involved as well, right?
Very much
so because I believe Knox Walk is involved. We all know Knox. We all go.
Knox happens to be the chair of the Southwestern Healthcare Coalition.
That's fantastic. Yeah, you had good things to say, of course. Great. So regular meetings, management of projects. Obviously, there's opportunities for EMS agencies to become more expertise, if you will, in that, and be able to share that same training to the many other EMS agencies in the community. That will certainly be helpful. Great. Anything else you'd like to add?
That grant money comes to the region. The participation in the coalition is your ability as a provider to sway how that money is spent towards preparedness. While it comes with restrictions from the federal government, we really need that boots on the ground, your ideas to make an informed decision of how we move forward and how we continue to build preparedness in the region.
That's absolutely awesome. And now, is there a booth here? I thought I may have seen a booth.
There is. If you're interested in it, definitely encourage you to stop by booth 314.
Okay.
We have all of those applications as well as some pamphlets for a lot of resources that have been purchased over the years, how you could get those resources if
Awesome.
you have the unfortunate need of experiencing an event that would require that.
Absolutely. So you heard it, folks. Stop by booth 314 here at EMS Update and visit some of the staff. Maybe you'll see some folks you know. We'd love to see you. Lots of great education going on here at the conference. Lots of good vendors. We really hope that you can stop by. Thank you very much.